The pancreas plays an active role in providing the body with necessary substances. This organ performs two types of activities simultaneously: endocrine and exocrine. It ensures the smooth flow of biochemical metabolic reactions, leading to good well-being, high productivity, and strong immunity. Disorders in its functioning can lead to unpleasant diseases, sometimes with serious consequences. Watch the video to the end to learn about the peculiarities of this remarkable organ and how you can maintain its health without medication, as well as what to avoid at the first signs of inflammation. The pancreas, a glandular organ, produces powerful digestive enzymes and hormones. Hormones maintain a constant glucose concentration in the blood, crucial for the proper functioning of the entire body. Decreased glucose levels lead to energy deficiency, while increased levels hinder blood circulation. The pancreas measures about 22 centimeters in length and weighs only 70–80 grams. It is located between the stomach and the spine, corresponding to the level of the first lumbar vertebrae. The organ is vulnerable and sensitive to adverse factors. Inflammation and malfunction can be caused by factors such as overeating, alcohol consumption, physical exertion, psychological stress, and severe infectious diseases. Even slight deviations in its functioning can lead to a deterioration in overall well-being, with serious consequences developing rapidly. Interestingly, the organ begins to form in the first month of pregnancy and becomes functional by the end of the first trimester. It has a lobular structure consisting of a body, tail, and head. The structural units are called acini, where digestive enzymes are produced. They remain inactive until they reach the duodenum, where they become functional and start breaking down food compounds. Amylase acts on carbohydrate molecules, converting them into simple sugars. Lipase breaks down animal and plant fats. Trypsin and chymotrypsin aid in the digestion of proteins. The pancreatic juice is highly active, transforming food into building materials necessary for the human body. The hormones produced by the pancreas are synthesized in specialized cells forming the islets of Langerhans, which include beta cells producing insulin, which facilitates the breakdown and absorption of glucose. Alpha cells producing glucagon, a hormone that raises blood glucose levels. Delta cells, necessary for releasing ghrelin, an appetite hormone, and gastrin, which converts proenzymes into enzymes. PP cells secrete pancreatic polypeptide, which regulates the secretion of all digestive glands. After learning about the pancreas, it becomes clear to everyone how important this organ is for human well-being. It ensures proper digestion and the potential for increasing the energy level of the entire body and every cell. Diseases of the pancreas can result from both external and internal factors. These include dietary irregularities and the consumption of any alcohol, sometimes even in small quantities. Other factors include the reflux of bile, which occurs in chronic liver and bile duct diseases, the presence of parasites in the bile ducts, infections affecting the liver, and traumas from mechanical injuries or medical procedures. Autoimmune disorders can also lead to damage to the pancreatic tissue due to autoimmune aggression by the body's own antibodies. Vascular and hormonal changes, medication intake, and diseases of neighboring organs are additional contributing factors. These factors can lead to toxic damage to cells, impaired blood supply, tissue metabolism disorders, and stagnation of pancreatic juice in the ducts. As a result, there is a disruption in the process of enzyme and hormone formation and regulation. Enzymes may start to activate before reaching the intended site, leading to the digestion of pancreatic tissue itself, namely inflammation and necrosis. Furthermore, the ability to regulate blood glucose levels is compromised, leading to disorders such as hyperglycemia and diabetes, hypoglycemia, and cellular energy deprivation. Pancreatic pathologies can be acute or chronic. Acute situations can be resolved with treatment and removal of the triggering factors. However, in some cases, acute conditions may progress to chronic ones, especially if treatment is delayed or medical recommendations are not followed. Pancreatic issues can be categorized as follows: acute and chronic pancreatitis, inflammation of the pancreatic tissue and ducts, pancreatic cancer. Tumors can be malignant or benign, often forming in the head of the pancreas and accompanied by jaundice. Parenchymal fibrosis, replacement of organ tissue with connective tissue after inflammation. Parasitic cysts associated with parasite infestation such as echinococcus. Cystic formations resulting from the formation of cavities in the organ tissues due to previous inflammatory damage, and the formation of concretions or stones in the ducts due to metabolic disorders. Consequences of pancreatic pathology include the development of enzymatic insufficiency and poor digestion, hypovitaminosis, and in some cases, avitaminosis, cachexia, or obesity as a response to metabolic disorders, diabetes, and metabolic syndrome. The pancreas requires careful attention, adequate treatment, and adherence to a proper diet even at the earliest stages of damage. Symptoms of emerging pancreatic problems can develop rapidly and be directly triggered by dietary irregularities, alcohol consumption, or physical strain, resulting in painful sensations. For pain associated with pancreatitis, the following characteristics are typical. Localization in the stomach area or left side of the abdomen. Girdling nature, spreading to the right side of the ribs and lower back. Discomfort felt in the area of the left scapula. Severe intensity, intense pain that is not relieved by painkillers. In cases of chronic pancreatic diseases, pain sensations are less intense, but increase with triggering factors. Pain in the left side of the ribs, radiating to the center of the abdomen and back with varying intensity, is the earliest symptom of pancreatic dysfunction. Other signs of pancreatic involvement include nausea, which persists almost constantly and worsens when exposed to food odors. Vomiting of gastric contents, with uncontrollable vomiting during acute situations, followed by very brief relief, and then recurrent episodes. Elevated body temperature accompanied by chills and intoxication. Often, the earliest symptoms include deterioration of general well-being, increased fatigue and exhaustion, abdominal bloating, discomfort in the abdomen after eating, decreased appetite, dryness and slight jaundice of the skin, increased sweating. With elevated blood sugar levels, increased thirst and changes in body weight are noted. If pancreatic disease is suspected, it is essential to seek medical attention promptly and undergo necessary examinations. It is necessary to have blood tests for general analysis, glucose levels, liver enzymes, amylase, and lipase. Ultrasound of the abdominal organs should also be performed. For pancreatic diseases and as a preventive measure against its disorders, maintaining proper nutrition is crucial. It is necessary to avoid foods that can harm or destabilize the organ's function and consume beneficial or neutral dishes. What's harmful? The enemies of the pancreas can be not only well-known fatty foods, but also seemingly neutral or even beneficial products. The pancreas is highly sensitive to what a person eats, so everyone should know what can cause issues with this organ. In general, the pancreas dislikes everything that most people enjoy eating. This includes fried and smoked foods, spicy and salty dishes, fresh pastries and sweets, carbonated drinks, and fast food. It doesn't appreciate overeating, frequent snacking, late-night eating, constant chewing, or alcohol consumption. Not conducive to pancreatic health is the layering of different dishes on top of each other and the ingestion of alcohol between them. Such combinations simply kill the pancreas. That's why there are such long queues at gastroenterologists' offices after holidays. Ambulances are often dispatched for abdominal pain after various celebrations. And, in surgical departments, doctors provide assistance to patients with pancreonecrosis. If we talk about specific products that harm the pancreas, the top 10 include alcoholic beverages of any strength and type, especially carbonated and sparkling ones, such as beer, champagne, and cider. Ethyl alcohol, the main component of alcohol, poisons pancreatic cells, irritates the stomach lining and upper intestines. This causes tissue edema in the organ, disrupts the flow of pancreatic juice through the ducts, leading to increased enzyme activity before they reach the intestine. This results in the digestion of parts of the pancreatic tissue itself, leading to pancreonecrosis. In addition to direct toxic effects, ethyl alcohol disrupts metabolism, reduces metabolic rate, and impairs blood flow, all of which contribute to pathological changes in the pancreas. All types of soda, packaged juices, bottled compotes, these contain substances that prolong shelf life and enhance taste qualities. These additives irritate the pancreas. Carbonated and acidic drinks stimulate the secretion of enzymes. But since there is nothing to digest, there is a stagnation of secretions, and the drainage function of the ducts is impaired. Fresh pastries, especially made from refined white flour that has undergone multiple purification processes. Delicious rolls, pastries, and fragrant white bread stimulate the production not only of enzymes, but also of insulin, forcing the pancreas to work harder. High-fat dairy products, among which hard cheeses and thick sour cream stimulate enzyme production the most. Legumes, such as peas, lentils, peanuts, and beans, require a high concentration of enzymes for digestion, which forces the entire digestive system to synthesize biologically active substances actively. Avocado, a popular and healthy fruit. It has many positive qualities. It has a preventive effect on the development of atherosclerosis and helps lower cholesterol. But since it is a source of fatty acids, which it contains in excess, it can adversely affect the pancreas. These same fatty vegetable acids have a positive effect on blood vessels and contribute to rejuvenation. However, they can also cause problems with the pancreas. That's the paradox. Mushrooms, prepared in any form, are heavy food for the digestive organs, primarily for the liver and pancreas. Fatty fish, especially when fried, salted, or smoked, stimulate the production of digestive juice, quickly deplete existing enzymes, and activate the synthesis of new enzymes. Semi-finished products and smoked meats made from meat, with the addition of spices and seasonings, contain fats and substances that stimulate enzyme production. More enzymes are required to digest them than to digest simply boiled meat. Pork, beef, goose, and duck, even without fat, contain many difficult-to-digest fats. This requires the production of lipase, the pancreatic enzyme that breaks down fats. In conclusion, it should be noted that moderate and infrequent consumption of these products is possible. However, it is important to monitor your well-being and the amount of forbidden but desired dishes consumed. Also, it's not advisable to combine several substances harmful to the pancreas in one meal. Through diet, you can not only ruin the pancreas but also support it. What's good for the pancreas? Proper nutrition is the cornerstone of good health. For food to positively affect the pancreas, it should be steamed or boiled, contain minimal salt, be low in calories and fat, easily digestible, rich in vitamins and minerals that help remove toxins, and non-irritating to the stomach and intestines. Among the valuable foods for pancreatic health, let's highlight the top 10. Oatmeal. Dishes made with or based on oatmeal have a strong protective effect on the stomach and duodenum mucosa. As a result, the pancreas works calmly without the need for increased insulin production, maintaining conditions that prevent inflammation and dysfunction. Egg white omelet. Egg white is easily absorbed by the body and contains essential substances for cell building without stimulating the digestive organs. Consuming it protects the pancreas, promotes minimal activity, and doesn't cause functional disturbances. Rabbit meat is a dietary animal product with minimal fat and maximum protein content. Its muscle fibers break down quickly into easily absorbed compounds, requiring no additional effort from the pancreas. Boiled perch. This freshwater fish is tasty, has a delicate texture, and contains minerals and proteins essential for the body. Its slightly dry nature, due to low fat content, is beneficial for the digestive system. Boiled shrimp. When preparing this healthy seafood, it's best to use minimal salt and a couple of bay leaves. Shrimp contain only necessary amino acids and minimal fat, promoting adequate metabolism and proper pancreatic function. Baked apples. It's better to use moderately sweet varieties. Brief baking in the oven gives the fruit a special flavor and increases the possibility of maximum breakdown into easily absorbable elements without requiring additional enzyme production. Although there's a slight loss of vitamin C, everything else is preserved and quickly enters the bloodstream. Stewed zucchini. Zucchini provides minerals and water to the body. Due to their high water content, all beneficial ingredients are absorbed excellently, making stewed zucchini the most beneficial side dish for the pancreas. With a little low-fat sour cream, they can be consumed as a standalone dish. Cranberry juice. It's the juice from these beneficial berries that has a positive effect. All the useful substances in the drink are preserved, while acidity is reduced. This allows for nourishing the pancreas without irritation and replenishing minerals and vitamins. Walnuts. Completely avoiding fats is not advisable since lipids form the basis of cell membranes. Vegetable fats are best absorbed and function well. Walnuts contain beneficial fatty acids, and their ratio is particularly adequate. To restore and maintain proper function, only a small amount, 2-3 nuts per day, is needed. Also beneficial are fresh greens, ripe berries and fruits, and tender fresh vegetables. Every time you sit down to eat, especially on holidays, remember that active digestion requires the pancreas to work hard. However, an excess of irritating factors can lead to disturbances and, consequently, diseases. Problems will not only affect the stomach but the whole body. So, take care of yourself, protect your pancreas from irritation, remember our advice, and stay healthy.